barkada.
I have a big family.
Making them happy is easy.
With the Dunkin' Donuts Big Deal
You get 3 boxes of donuts.
for $3.49
It's just like adding 50 pesos.
to the price of your favorite bundle. Make more people happy.
With the Dunkin' Donuts Big Deal.
GPBI TV11. Disclaimer. The views and opinion expressed by the host do not necessarily state or reflect those of the network owners, the company, and management. Furthermore, the views and opinions of the guests, program participants, phone-in text messages read by the host, or any utterances by the guests as reaction to comments or news made by some persons do not reflect nor express the official position or views of the station owners, the host, the show, the management, and the network. Due to the social nature of broadcasting station, videos may contain contents copyrighted by another entity or person. The station's owner claims no copyright to the said content. All videos from this station were not monetized. The broadcast of this station cannot be held accountable for the copyrighted content. The broadcasters of this station is a messenger and sharer of information and strives to verify but cannot warrant the accuracy and correctness or completeness of the information in this program. The public is forewarned from making unnecessary association or imputation to the network and its owners of such views and opinion that is purely and strictly independent, separate and distinct from that of the official position and opinion of the network, the station owners, and the management.
Chavacano, un poquito español. Si te conversa Chavacano.
Buenas tardes. Este el Dateline Teleradyo Enhanced Edition. Mga bisinos, takiata mi kita tan junto, un oray ni media, na di atong programa, no, manada kita mga notisya, komentaryo, y otro mas. Junto conmigo ki el di atong veterano, announcer y newscaster na si Albert Luna.
Gracias contigo, Doc Mile. No? It's nice para man partner kita, magabisinos for the first time naman junto yung kun Doc Mile, Amsid, magabisinos. Buenas tardes otra vez, this is the servidor Albert Luna, manjunto namon hasta las 5 del tarde, donde, of course, as usual, la presentación del diaton discurso aquí with Doc Mile, Amsid, magabisinos, cargao del informasyon también.
Okay, so man-start kita, no, di ato na importante development y notisya. Sabi to Albert, el Ateneo de Manila ay asesale estudio na tiene daw millones de COVID-19 cases aquí na Pilipinas, possibly undetected. Diskutiya kita con ese ayer, con ese estudio del Ateneo de Manila, no? Y conmigo, porque usted repiti, kay el di aton topic ahora, el BHERTS ase también el gobierno lokal, no? Kay pati mga contact tracers. Kasi sabi ustedes, necesita kita man trace con estos mga gente tiene undetected COVID-19. Cosa tu ta pensa con ese estudio del Ateneo de Manila?
Well, iyo mismo taman agree ko na este gane Doc Mile, no? Kay el cosa kita ta pwede mira magabisinos na komunidad este magatiempo. El quien lang ta pwede man catch, aquellos lang tiene symptoms. Por eso taliba kanila no hospital, taman swab kanila, taman subject kanila triaging, taman swab kanila, only to find out the berasan confirm positive sila. And with this pronouncement, possible, tiyan pa mga undetected alikay. Resyente lang aki ka nato na syudad de Zamboanga, Doc Mile, aliparte na barangay de Santa Catalina, un persona que taesta na un tricycle, tiene sintomas, found to be positive, unfortunately died. Este lang mismo dia magabisino sa informasyon estaba kung tagawad Jordan Evangelista of Santa Catalina. So this is a reality on the ground, no? And grande ayuda talking about BHERTS magabisinos and contact tracers di aton. Si mas manada kita contact tracers, mas manada kita swabbers magabisinos, and active gayod, equipped gayod el di aton capacitated gayod, don tiene gayod ablagan kita mejoras el di aton maga BHERTS, kompleto sila del maga equipo di ila. Possible as millions kita abla el di aton este Ateneo de Manila University, posible step pwede man catch. I mean man catch, pwede kanila man isolate, man test kanila, and man cure kanila sa pwede.
All right, no? So that's a very good point tabla si Sir Albert Canaton Ali, no? We need to consider si ta pwede gani kita sabi tiene tan aksidente kabata check sila COVID-19, no? Manada el reaksyon del di aton mga hermano y hermana ali tauwi tabla ay porque man taming se tabla tamin COVID-19, yung aksidenta lang COVID-19. Well, ese estudio de Ateneo de Manila tamandamira lang kanato na hindi ese como conspiracy. Akil ba el mga tiene mga otro mga ablagane kita mga sektor, no? Tan promote ko na ese conspiracy theory tabla sila na taas lang gayo ta miedo kunel mga gente na ese COVID aquí tiene COVID alia para ano lang gayot para abla lang at grabe at sitwasyon, no?
Tiene pagane o otro mga conspiracy ali kay tabla kada pasyente tiene porsyento daw el mga eksperto di aton. Sabi to Doc Mile last Saturday yaman hunto kumigo yaman gas na kwento isulod el di aton dos mga doktor. Kenta man rounds gayud na Zamboanga City Medical Center and a nurse kay taman served na private hospital na triaging. Tiene gid impression mga gente kita abla taase-ase lang sa kamo pero mga bisinos, it's scientific. Taman test, taman swab kun ustedes, makina si el taman test, el makina si taabla, si ustedes negatibo o positibo del COVID-19.
Okay, so amo se el querio manda habla con el público, no? Si ya tiene ustedes ya sabe na ya aksidenta kabat siya ni COVID-19, likely amo sos mga gente na undetected, no? Of course, hindi kita tan discount el posibilidad na ablagan kita estos mga gente tan take advantage lang kun el PhilHealth packages. Kay uno tamen sa mga talamang kita conspiracy theory ali na para el mga hospital lang entra na PhilHealth package de COVID-19 ay ablaya lang COVID-19 positive se. Pero mga bisinos, you have to remember ese resulta de COVID-19 LD aton sa mga laboratorio, the Department of Health, pati laboratorio ali, managed by the Zamboanga City Medical Center. And esos mga resulta, hindi sa pwede lang kita man fake, no? Especially akal mga taabla ali na ay el local government lang si kere ang sinaklase de sitwasyon.
Correct.
El datos taman da mira kanaton na most likely ese mira kita COVID-19 infection community transmission yase, no? The people are already transmitting ese disease tali ese na komunidad si ta pwede man tiene ta aksidenta ta sabi COVID-19, it must be because that they have been undetected for some time.
Uno pa additional lang kung Doc Mile Amsid Magabisinos, el testing por ejemplo yaman swab kumigo iyo el tiene sintomas. Yaman swab kumigo, el di aton mga swabbers, no? Assisted by the City Health Officer. El swab result is either Imbiana, di aton COVID laboratory na Zamboanga City Medical Center and DA laboratory which manned by ZCMC also. Si tiyan na si resulta, hindi si direktamente Doc Mile, dali na gobyerno lokal resulta. Tapos na DOH, na di aton na ablagan ni kita regional surveillance or regional epidemiology and surveillance unit or reso del DOH9 itambian apenas sebutan na City Health Office itambian na gobyerno lokal. So the local government unit has nothing to do with the results del di aton na este mga pasyente. DOH tadale el resulta na City Health Office and tadale na gobyerno lokal.
Okay, so let's revisit again ese gani report i-study del Ateneo de Manila University, Mambay, manda kita mira. So ese tabla lang kanato na manada ya milyones de Filipinos ya tiene COVID-19 y so far hindi pa kanila ta pwede man detect. And hindi sila in thousands sa mga bisinos, in millions sila. So let's move to our next topic. Sabi ustedes, el August 20, 2020 ahora is a non-working holiday for the observance of the Amun Jaidid or the Islamic year, no? Holiday tan enjoy kita ara, it shall be observed in the provinces of Basilan, Lanao del Norte, Lanao del Sur, Maguindanao, North Cotabato, kusa pala otro mga probinsya ali Sir
Well,
Albert.
Basulta area.
Sultan Kudarat, Sulu, Tawi-Tawi, Zamboanga del Norte, Zamboanga
Sibugay.
Sibugay, Zamboanga del
Sur,
Patikosa pa.
Cotabato, Iligan, Marawi, Pagadian, and Zamboanga.
Okay, so aquí na Zamboanga, since covered man kita del holiday, Lego, ojalá liga aquí el uno representante del Muslim community para discutir también el religious significance de este Amun
Jadid.
Jadid, no? Talama sila.
Si el Islamic New Year.
Okay, no? So, let's reserve that particular, conversation, Lego, para pwede ganigat kita sabi, no? El meaning del religious observance este. Now, anda kita mañana is another holiday and el quien kita ta celebra el vida di Ninoy Aquino, no? El bonito este cosa habla aquí, no? A minute of heroism is better than decades of useless life. Kasi meaning contigo este Ali.
Well,
Sir
debarasan
Albert.
ese, no? Ayadali ka naton un vida lang el Señor. So, we have to make the most beautiful things, no? Usa ko del vida y queda sirvi como usa kita con este para del buen cosa, no? Ablagani kita a minute of heroism, no? Not necessarily pirmi totally heroe to or not necessarily this time kasi on the modern age hindi to necesita muri para dal dito yung nasyon para kaya lang to heroe.
Correct.
Little contribution mga bisinos by staying at home. Correct ko na di ato mga abiso de la health protocols, use wear a face mask, frequent hand washing and social distancing. Hero ya ustedes mga bisinos.
I like that, no? So dali kita palakpakan kun mga diaton mga listeners.
Diba? Oo. Stay at home and be a hero.
Okay, mga bisinos, anda kita aura con un importante ordinación del obispo aquí, talama kita de Zamboanga na si Moises M. Cuevas. Siya pwede ba to con este nota, este episcopal ordination del auxiliary bishop di ato na si Moises M. Cuevas, DD.
No ipayo sa banmit ko nila pero
Okay. So, na August 24, Monday, that would be next week, no? Next
Yes.
week. Este si Moises M. Cuevas, DD, quedaste auxiliary bishop de Zamboanga City. Como amo este el number 2 aquí na ciudad. Deputy
Oo,
bishop,
correct,
no?
correct.
Así na. So, Monday ano kami con ustedes, te invita a todo mga Katoliko, todo mga Katoliko na si tiene ustedes tiempo, paborya lang man-observe el minimum medical quarantine protocols,
Correct.
no? On August 24, Feast of Saint Bartholomew at 9 o'clock in the morning at the Metropolitan Cathedral of the Immaculate Conception, Zamboanga City. Alright, so mga bisinos, anda kita aura, pidi lang yung kun Sir Albert to kindly lead to us the case bulletin 159.
Okay. Mga bisinos, el di aton total active case sa Desal Department of Health COVID-19 Case Bulletin 159. Total active case na entero nasyon mga bisinos sa tiempo is 61,025. El net of COVID-19 deaths and recoveries. El aumento di aton para este día bien alto, no? 4,339. 4,339 confirmed cases out of the total tests done by 100 to 109 laboratories. Tiene de con todo alto caso mga bisinos top provinces nationwide. NCR pa syempre with 2,590. Segundo el Laguna with 223. Cavite with 155. Cebu with 128 and Rizal with 109. El di aton description or disposition of active cases, el de con todo alto, el mild cases with 91.3% mga bisinos. El total cases di aton tiene kita cumulative number mga bisinos is 178,022 cases mga bisinos.
Okay, amo sa el mga latest figures di ato. Na yung cover ya ba kita el mga hente yan test sila.
Nuay pa alya el test.
Okay, Ma'am Bay, let's kindly take a look at the number of test results. Siya ka ba? And pati el mechanical ventilators, yung cover.
Nuay pa tamen.
Pabor, we need to take a look at that, Sir Albert, para we can also update the people. No? So, nextly would be mechanical ventilators di aton.
Okay, tali mga bisinos, no? Asa lang kita po ko grande para ko mga tiyan problema na vista. 53% available ICU beds mga bisinos na total of 1.7 thousand total beds. 47% occupied. Na isolation beds di aton with 12.6 thousand total beds. 47% occupied, 53% available. Ward beds di aton at yan 51% occupied, 49% available. Mientras al ventilators di aton, bien minimal al numero del ventilators worldwide mga bisinos, 31% with the 69% available. At least alto pa syempre el numero del mga ventilators. Taruga lang kita mga bisinos kay mga ventilators tausa se para ko ng mga severe cases sa Docmile, no?
Yes.
Akela tapo niya tubo na dila mga boka mga bisinos para resulya kay ben apektaw ya LD ila mga respiratory system.
Okay, so definitely we have to take note sa gani inventaryo de mga kama, de mga ventilators, alin na mga hospital pati isolation facilities. Aura, anda kita na testing, kwanto bilok mga Filipino yabayan test kita na RT-PCR.
So, el cumulative testing statistics da aton mga bisinos, total individual tested is 2,041,798. No, since day one el licensed RT-PCR laboratories di aton nationwide is 82. Manada si pensa kita del Marso mga bisinos kwanto bilog lang del RITM lang kita konose. Licensed gene expert laboratories uno na Zamboanga City tiene 27 laboratories mga bisinos nationwide.
All right, gracias gayot Sir Albert Luna. Na mga bisinos, anda kita aura con el importante bisita di aton aura, no? Este uno prominente persona y manada ele contribución, no, na disuyo comunidad, especially na Muslim community di aton. Aura ele ta ayuda con el di aton mayora ben klima ko, no, na programa de barangay, no? uno también hablakan kita bien, he is a man of letters, he educated himself very well, no? In public administration, hindi ba engineer Urao? MBA, no? At the same time, he is a licensed engineer. So, takika natin hunto, no, si Engineer Al Urao. Buenas tardes, Engineer.
Buenas tardes. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Buenas tardes ulit, Sir Mile, Doc Mile, and then Sir Bert. Jackie ulit, no? I thought I was here kando dala ayer, anti-ayer siguro, no? In the exigency of the issues at hand na puwersaw kita pirmi abuya, pirmi man appear, no? Na para manawagan lang po dahil itong sitwasyon natin sa ngayon, alam naman nating lahat na medyo tagilid tayo in terms of the data that we are getting now on the ground in relation to this pandemic, Doc, no? So yan po ang napag-anuhan. In fact, if I may just add, this morning again, through the facilitation of our good friend here, beloved Doc Mal Amsid, no? He facilitated another meeting among different head agencies still the local government, no? Again, in an effort to hopefully come out with a very effective measure by which to really address this pandemic. Kasi mas kita pirmi taabla Sir Albert, Sir Doc Mal, no, that this pandemic really is a new one. It keep changing, no? El mga theories na pwede kita pensa del antes, sometimes it may not be true now, yeah. So we have to really be constant in strategizing and actually we on behalf of the city government would like to also thank and congratulate Doc Mal Amsid for being on board, no, part of this collective efforts.
Okay, so man segue ana kita po ko kasi si Sir Albert, siya na pregunta contigo about the significance of today's holiday.
Well, parang,
I'm always
correct.
pushing Sir Albert to
Para
certain
umenta lang yung Doc Mile, no? Parang nila espantal mga bibiyantes di aton. Si Engineer Al-Uraw Magabisinos, como LL Bihertzar dahil di aton gobyerno
Hindi man también,
on COVID-19. LDC technical expertise tabasyale para ayuda ko del gobyerno lokal. Fuera que LL appointed executive assistant también del alcalde Beng Climaco. Pero esa que pregunta ko sa basta celebration ara New Year del mga Muslim este tiempo amun jadid no Islamic New Year.
Yes,
Can
yes,
you give us a little information kung este celebration, Engineer?
Well, amo ganit kay Sir Bert, no, for the information of everyone, miskin inante ganit, chene mga amigos diaton ta pregunta. Engineer po sa occasion ara. Today marks the first day of Muharram, the first month of the Islamic calendar year, no? Kasi kita dalama kami Hijri calendar by which we follow the lunar counting, no? So the Amosel Islamic orientation, no? So today marks supposedly the very first day of the year. Nasa 1442 Hijri kita ara, Sir Bert, no? El mga vital actually in essence, no, Muslims do not really celebrate. Okay. No, we just like feel the importance because there are some historical importance, significance na pwede kita man relate ko na. So if you may allow me just a couple to mention, no, it actually marked the instance by which our Prophet Muhammad and some of his Sahaba, we call it his Sahaba or his disciples, no, migrated from Mecca to Medina. That time, no, when Islam was just still starting, no, they were actually persecuted in Mecca, no. So what they did was, upon the instructions of Allah Subhanahu Wa Taala, no, the Almighty God, they were instructed to migrate to Medina. And history will tell us now, when they were already in Medina, they were able to freely observe their practice and propagate Islam. Hence, it has spread far and wide. And another important memory pwede kita man associate ali is because of this hijrah, because of this migration done by the Prophet Muhammad, they were able to establish the first Islamic state, no, which is in Medina Al Munawwara, no. So kasi el mga gente alya na Medina, according to history, they were so kind and accommodating. Receive sila in good heart, in good faith, the entrance of Prophet Muhammad and his followers, no, when they migrated from Makkah to Medina. There are yet many things that we can say, no, but these are the foremost noted in history in Islam.
But in this celebration that amun jadid, although taki kita na pandemic, but in a regular situation, kaya na bagat sa mga in grande celebration na Engineer?
Well, actually, Sir Bert, for us daw hindi gani lebien abla kita notifiable, no, hindi kat lebien abla recognized event, unlike if you compare it to like mga hari raya di amon, no. Hindi kasi sabihan ano gayot, no. We are not used to celebrating it in a normal way. I mean in a abla kita akel si komparato na akel ko sa kami taas during mga hari raya.
Correct. Oh.
Being este clase de religious observance, poco subdued compared alya na Hari Raya ano festival di aton, no? Okay.
Yes.
So got you on that.
Thank
Now,
you.
Mga bisinos, imbita kami aki kun Engineer Al-Uraw, no, being the executive assistant of Mayor Beng. Kasi gani, siya na kita issue about COVID strategy di aton. Kasi he is part of that COVID strategy. Mandayo ko no sa Desmira, un picture na ta explica si Mayor Beng COVID strategy. Ya pwede kita saka na un screen grab ali na picture di Dr. Noel Tarasona, no. As you can see, si Mayor Beng ta explicale kung COVID-19 management strategy. Engineer Urao, would you like to say something about that one?
Well, actually, hindi man si abla kita nuevo gayot Doc Mal, no. In fact, if I may recall, that illustration has been presented to us by our beloved mayor even at the early onset of this crisis, of this pandemic. So amo sel tase kita abla kita di aton guidance, no, abla kita directive, no, by which how to handle the crisis, no. Hindi agad yung pwede miragat mo na mente ko na, but that specifies Chenya na identify el city government at least 4 key areas no by which to concentrate, no. So among other things akil di aton mga border di aton boundaries, no, di aton management del mga incoming ano, among other things, no. Amo kel Doc Mal.
Okay, so as I said, amo sa el ta explica si Mayor Beng, no, el COVID strategy di ese. Kosaya pa sa in response ese with the existing COVID-19 data that is being maintained by the local government of Zamboanga. So, ese picture ali ta pwede ustedes mira. Amo se el one of the latest figures that we have on COVID-19. As you see, based on the graph, no, el numero de COVID-19 infection is on the rise. Let's go down below Alia Mambay, Alia Abajo, Akachene graph. Okay, maybe you can even blow that up, no? Perhaps si Al Urao would like to discuss about that. No, pero if you look at the graph, no, so the COVID-19 infection rate is actually going up. And alina side contigo, that is what you call the positivity rate. Is that the positivity rate at 11.94?
Yes, yes.
Can you look at it?
El positivity rate with 11.94%.
Okay. So sabi ustedes, el positivity rate that is standard daw or acceptable is around 5%. Of course, in Zamboanga, it's 11.94 because el amount kasi is in digits, few digits lang. That's why grande el amount di suyo, no? But in Manila, it's much lower kasi based na dila amount, outstanding amount, thousands siya kasi sila, hundreds of thousands siya sila. So, in terms of percentage, lower yase, no?
Correct.
However, si pensa-pensa lang at kita bonamente, if you look at the data set, no, we need to prepare. What the message, ablangani kita, el take-away message ali, is that we need to prepare for the increase of COVID infection. Now, kosaya ase el grupo di Engineer Ura was they prepared a group of people called B Hertz. I hope we can show the pictures. Engineer Urao, could you please explain what the role of a B Hert is?
Yeah. Okay, thank you, Sir Miles. No, actually, amos tekere kita man focus because what the figures maskin on the pa air sources ta pwede kita saka, no. We in the city government, we are using the Facebook page del nombre di Mambeng, no. Akil tan display kita LD aton mga updates del statistics, no. My last view on that akil taabla chenya kita total cases na Zamboanga 897, no. Total of the 897, 300 chenya kita 360 active, and then 501 recovered, and then 36 deaths cumulative, no. So what are these figures indicating, Sir Bert, Sir Mal, no? From these figures we are seeing, no, nay mas kasi si el breakdown, pero si mira to el breakdown ali 299 of the 360 active cases are actually community acquired. So ko sa kita kiri man emphasize aki antes el di aton abla kita onde kita tache ni miedo, no, el di aton spread or contagion talya confined na mga CRC aton di aton reformatory center el mga incoming LSIs, but now it's not anymore, no. Otro el caso ara el scenario ara at mira ustedes aquí ko sa eso se cercano de los vecinos na campaner, no. Uno lang yan infect kalayat dayon and they goes to the numbers of about 30 plus, no. Naun source lang kaya this year el contagion, no, at the community level is now on the loose, no. Ben grande atakeda. So that the figures are showing us, no, that about 80+% of the contagion, 83 actually, pwede kami saka del anoche, no, in terms of the numbers that we have, around 83% are now related to community transmission, no. So carry this year, Sir Bert, Sir Mal, amusta kami kita carry man emphasize na city government na di aton local government, no. The fight now is on the ground. Debe alya kita pone di seryoso because si abla-abla lang, si por ejemplo pa na Pescaw, yes kapaya ba, Sir Bert, no, talya sila kalayat na kilono. So what can be done in the situation ara sabi kita that we do not have yet a cure for this disease, no. May pagat kita abla medisina ko nese bakuna man, no. So kosa LD aton abla kita preventive ano LD aton pakila kita imbesti ko nese pandemic is basically prevention, no, preventive measures, no. So por causa na preventive measures debe asigat kita ano adi aton advokasya para na kumbinsi ko ng mga hente aman ayudahan kita todo. Hindi este trabaho lang del di aton city government, del di aton healthcare sector, el media igual con los otros na hindi ata para akin na kada na station tan remind everyone on a constant basis. It has to be everyone's concern, no? So debe man send kita el message nam di aton mga bisinos na mga di aton mga amigo akin na siyudad de Zamboanga that in the el responsibility to help fight COVID is now to everyone, hindi lang ginda na di aton gobyerno, no? For the last kuando kita ya prinsipian lockdown aki, that was about second
20.
week of March, no? So second week of March up to this time, that's basically more than 5 months. 5 long months. Si Sir Albert kadadiyaya kitang kwento ko.
Actually, it's officially 5 months STD.
Na, you see,
March 20 kita. Lockdown.
So, similarly, everyone that are at the forefront of this battle, abla kita, benkansaw ya. So, musta kita kiri liba panawagan mga bisinos, el guerra, el pelea con este COVID virus, talya ka nato na diaton alrededor. Por eso, necesita kita man ayudahan. Along this line, chene kasi kita by law, no, a component, a team created by law at the barangay level. Amo sa LD aton barangay health emergency response teams tala makita BHERTS, no. So because they are already there in place, simira kita health emergency responders sila. So iso kumpara to Sir Bert, like siya kita say like first aider, no. Si for example iri kita before to Corona Hospital, chene anay kuntigo man ano as first aid. So our BHERTS team are actually illustratively defined as that, no? So because of this arrangement, at least siya kita gali ali component manpower na ground na pwede ayuda ka naton at the community level. So what we did was for the record, in fairness to our local interagency task force, siya si kanila like general orientation, Sir Bert, couple of months back, no, pwede masya ako sa month, no? Actually I was not yet with the government that time, but I was made to inform that there was already an orientation. But unfortunately, hindi man abla na todo. Our partner agency, USAID Reach Health Project, yakundusi si kami assessment, no? Yan ikot si kami, although hindi ka tabla todo, select barangays to assess. Actually, pregunta kita, ustedes BHERTS, kasi ustedes saber na di ustedes function, na pwede ustedes ayuda para COVID, no? To sum it up, the assessment yakundusi kita, hindi ka tabla bien satisfactory. So in short, in coordination with the city mayor and our lead agencies na on this fight, no, yabla sila, we need to revisit our BHERTS team. We need to capacitate and strengthen them. So amo se yaso se Sir Miles, no, Sir Bert, our partner agency, USAID Reach Health Project, sila ni sponsor kanaton BHERTS Strengthening and Capacitation Seminar, training workshop actually se. It's a very comprehensive training, no? El coverage DS, that's about 40 hours training actually, si mira-mira to. Pero yung compress si kami, the exigency of time, el necesidad, no? Yung compress si kita, yasya lang kita na 1 day. So we invited 15 priority barangays. And coincidentally, these 15 barangays are basically city barangays, Sir Bert, no? Coincidentally, si Miracle el figures del de la contagion, sila el pinaka-alto chene cases del ano, no? But nevertheless, the seminar proved to be very helpful. From the output from the participants themselves, yabla sila, oy, bonito chene kites the seminar. At least we are now made aware of the many things, no? So it's a very comprehensive seminar. So in our meeting with Dr. Mal na City Hall, we were pushing and hopefully suggesting to the authority diaton nakil mga diaton mga encargao alye na if we can continue such effort, no, because we have to realize that we are not only 15 barangays in this city, we are 98 barangays actually, no. Although we thank God there are still barangays that are COVID free, pero si mira to si itcha to strategy ko na na ground, it's better to experiment it on a barangay that has no COVID case para pwede kita mira pakilaya sila implement ipakita ko na si formula, no? So going back, chene si ratio, Sir Bert, Sir Mile, no, na provision del national directive, no? El composition der bihertz debe se chene to un bihertz team per every 5,000 population in your area, in your barangay. Now we know for a fact that in Zamboanga City, we have barangays that are as big as municipalities, no?
Correct.
So like for example, di aton barangay alya El San Roque, the state is San Jose Guso, no? We have about 7 bihertz teams in our barangays, no? So ansi na I mean, for the record, on a potential basis, we are at least steps ahead already kasi tiyan kita mga bihertz team already organized, no? Kusa lang kita necesita kanila is to capacitate them, educate them of the real functions kasi el antes, I'm sorry, I'm not saying amueste el general perception, no, pero there are bihertz members that confess to us el cosa sila saber el dila role si tiene liga LSI de dila barangay anda lang sila mansundo, mansundo na airport, mansundo na pier kabar liba na possible isolation facilities, so home quarantine, liban na di ila casa. No, that's not that. Our BHERTZ team is our frontliner at the community level. So, debe si kita pwede man emphasize.
All right, very good points that you raised. Now, Elia sabiyo, yan training o series ko na sa 15 BHz, tiyan o series plano, man-expand ko nese to the rest of the barangays, especially na rural areas, hindi ba?
Ideally, Doc Mar, we hope so. And if I may add siguro, total, takyaman nyo tan-explain kung nubos otros ko sa di aton mga measures na kaya kita impone ali na komunidad, no, na ground. Because we say that the battle is already on the ground na community. Aside from the BHERTZ team, Sir Bert, Sir Mile, no, siya kita talama akel contact tracing teams, no? And there are directives now coming from the national government, from the national agencies, also with our local agencies, from the ILG specifically. They are now mandating the barangays to also organize your own local contact tracers, no? So, chenese mandate ara, no? Directive actually from the ILG, no? So, the contact tracers are different from the BHERTZ, no? Kasi el role del contact tracers, si chene kita infection ali ko sa lugar, sila se debe sabi Sir Mal, Sir Bert, ken el mga gente pa ya pwede man contact ko si victim, no? Ko si di aton na abla kita patient. Okay? So, because of this, el contact tracers will play a more vital role, more important role than the BHERTZ themselves. Kasi el BHERTZ, facilitator naman sila, coordinative LDL function. But with a contact tracer, ele pwede prevent, no? Ele pwede para kung el possible contagion, spread del virus in a locality, no? Kasi porque siya pwede le sabe kung ken akel uno positive itsa kita yan yakida infectao, kung ken liyang kwento yan meet onde le estaba onde le aginda, pwede si kita asila gas and hopefully track who are those that can be possible suspects ya también, no? So this is the expectations at hand, Doc Mile, and hopefully we could seek again the assistance of USAID itself, no? Actually after our meeting earlier dinante, no, asigat yung lagas ko na di aton mga amigo na Ritzel, tabla kami if they really could arrange for the soonest arrangement, pwede kita man conduct namin contact tracing training workshop, no, para sabi sila pakilayagat ase el being a contact tracer, no. So amo se el mga outstanding ablakita manera na kiri kita pone ali na barangay level. So me Engineer Aluraw el mga otro sabi specifically na District 1 pero akel mga diatan amigo na district no kuno si Pagayot, no. I am actually the point person one of the point person yan si ma'am, but specific to this Rich Health project programs, no. Keda el like coordinator of the city government. So expect us, our team, no, in these coming days to be really in constant contacts, in talks with you. Kasi kere kita man capacitate kung boss otros, if you studies BHERTZ team, if you studies contact tracers, no, we will be delivering letter now to the different barangay captains starting probably on Monday, no, to get the recommendees, no, kere sila incluhi ko na si contact tracers, no. So Mambing was also saying earlier na hopefully we could find ways by which to somehow give abla kita maskin mga allowance ng Conesos, no? Because currently now, Sir Doc Mal, Sir Bert, while the Congress now is deliberating, nanti ko yung status ng kwento kung naldi aton Congressman Del Masa si Kong Jawa, no? Currently they are deliberating the Bayanihan to Hilas 1 up to DILG and back up by the different health agencies, no? Tapi di sila na Kongreso appropriations to hire about 50,000 additional contact tracers for the entire Philippines and the entire nationwide, Sir Bert, no? Kasi WHO recommendations, World Health Organization recommendations, debit siya to uno contact tracer per every 800 population or residents, no? So na comparison pa di Secretary Anyo del DILG ablale, if we have about 108 million, we are looking for quantos more than 135,000 contact tracers in nationwide. Aki kanaton na Sambuanga, si Mirato, if we will roughly estimate our daytime population, we see data population akirtaki, no, from about 900 to 1 million, Doc, at a ratio of 800, we should be expecting around mga 1,250 to 1,000 contact tracers. Yes,
That's right. So, mga bisinos, definitely, kosa se tabla si Engineer Al con ustedes, no? Man-hire kita o busca kita mga gente para kita contact tracers kasi el enfermedad de COVID-19 yaligaya na mga rural areas. Dati niya kita receive mga reports na el mga barangays that were initially free from COVID-19 tasalea el mga numero. Initially, of course, they are low digits, no, 1 digits. But however, nisisita gani kita as Engineer Al is saying, nisisita kita liba kunel di aton fight alina COVID, alia gayot na mga barangay siya gayot para nisisita ustedes ayuda, no? So, tarindi kami gracias kun Engineer Al Uraw, kaya sabi kami holiday holiday pakat este de mga Muslim, no? Pidi kami kuntigo dito yung closing remarks and of course to allow you to greet on behalf of the team of TB11 the men and women of TB11 para na mga Muslim community. Tuya man deliver.
Oh, well, actually, again, the place you should be mine, no? Yeah, dahil ustedes again oportunidad aki mangguest na ustedes programa, Dateline TV, the management and staff of this beautiful station has always been very supportive, no? Para nabuendel di aton mga bisinos, di aton syudad de Zamboanga, sabi kami LST station taligat sina forefront, no? So we have been very thankful for having this lovable institution na takeda di aton source of reliable information, no? Factual and reliable information tadali bos otros para na di aton mga seguidores, no? So we thank you for that. So I may as well with much pleasure to bring this lovable station and the management and staff para mang-greet kunel di aton mga fellow Muslim residents in the city pati na to daya siguro, no? So assalamualaikum warahmatullahi taala wabarakatuh, mga katotay manghuran muslimin di murungog diha programa sin Dateline, hipasampay na mo in salamatahan salaman pagtumtum na to, no? Pagtumtum na to sin amon jadid sin adlaw ini mura-murahan in tahun bago sumud ini hilamod na to harwaan na to lapas na inhula na to hatungod sin sakit pa niya kita mo na yung COVID mura-murahan hiduaan na to hilamod na to mga ruaan na to sambahayang na to pagsujud na to pagdoko na to mangmanlapason na kita ni sin Allah Ta'ala salamaton in hula salamaton in katan panginduahan na to yung mga kyuddan sin sakit mga nagka-infect bangman mura-murahan ini makarecover na sila kasamutan iban bang manwero na isab malamin na sabi na sinagi yato Allah Ta'ala in long tahi pagtakdir niya sa yari kato in sabab so hipakita na to muna rin diha city government diha mga katotay manghuran na to ini iwan na to dan dia hula sin Sambuangan, in kita niyo kauman muslimin, maingat kita niyo mag-akad sara. Hipakita na to in fight sin COVID ini, yari kita niyo gaman ti mata ayon, no? In pagpangatukan niya, simple da, cleanliness, no? Maghukas lima, magbutang face mask, makad sin aturan sin sara, no? So banglong sin sara, so ikaw maka-face mask bang kau kumuha, ando kayo lo pag-akad ka mo. Impact Amorainin City, relax in regulations in Zamboanga City. Basta misan pa siya, bukod na siya surgical mask biya ini, basta sa jaon hikatabon niyo, mga cloth mask yan, washable mask makajari. Ha? So basta in talion na to, may tayan kita butangan regulation biyahan, hikarayaw rakato tanyo katan. So mura-murahan, amoy team message na mo. So yo bira ulit aki na kunel station, no? Thank you for the privilege and thank you for being our partners, no? For and in behalf of the city government, this station have been our constant partners and thank you for that. We look forward to more partnerships to come, no? The fight against COVID is everyone's fight. Debe kita todo man involve ourselves, no? Let us contribute in whatever manner we can to help solve this, no? El pinaka basics ayo sir Bert is to start with our own selves. I have to protect myself. By protecting myself, I will actually be protecting my family.
Correct.
In the house, in the home. By protecting my family in the home, I am actually helping protect my neighborhood.
Exactly.
No? So if we protect our neighborhood, el di aton komunidad protect tao. Hindi kita grande el problema. I really abla kita tanano yan na makalastima yan, no? Naaawa na kami sa mga kasamahan natin sa health sa healthcare sector. Inanti an meeting kami daw bengkansaw yagat el todo, no? So let us all join this fight. El di aton hashtag aki is we heal as one. So thank you for the privilege. Let us all include in all our prayers, no, in whatever denominations, whatever belief we follow. We are actually asking the Grand Almighty to spare us from this disease and let us bring back our lives back to normal the soonest we can. So we can only realize this if all of us will be complementing, helping each other. So ojalá mga bibientes, seguidores de esta estación, pati bibientes de Zamboanga, let us all be partners and abla kita contributor to the healing of this pandemic. God bless. Wassalamualaikum, baya kon Diyos.
Okay, amo sa si Engineer Al Urao. Dali kita ko nila di atod poko applause aki. Ho?
May correct, oo.
Thank you.
Well deserve applause mga bisinos kay Ben Trabajador también el daton compañero.
Okay.
Sa kundi ko Doc Engineer Al Urao mga bisinos.
Thank you.
Okay, so ladies and gentlemen, amoy gani kel no si Engineer Al Urao, el uno del diaton mga hardworking executive assistant ni Mayor. You have to realize mga bisinos, yan choose kat kunele si Mayor Beng para man-handle gani kunele sa effort. Kay grande LDCU kumpiyansa kun Engineer Al. Now, man kwento kita in a while kun Provincial Director Grace Aduca for the Department of Trade and Industry. Pero waltan kwento kita ko nila at waltan prikura kita man kontak kun Director Grace. Kaya arayo con ustedes habla na el Department of Tourism mga bisinos ta preparaya para abri ko ng mga tourism sites aquí na Zamboanga. Did you cover this, Sir Albert?
Well, actually, pwede lang sa kita mira no, na social media account del Alcalde Beng Clima ko kaya ansin el modi aton. Like actually, akado sa aton birada na MGCQ, it's the second time na LD aton na Tourism Office prepared for this opening gani, no? Okay. But unfortunately, from MGCQ, bila kita utabes na GCQ the past few days, mga bisinos, or past few weeks. Pero taman workout sa LD aton na gobyerno lokal, no? Kay ablagani kita uno dal mga sektor que necesita también movea amo el sector de turismo también que afectado la vida también del mga vivientes di aton.
Okay, mga bisinos, man-extodo ana ito, Sir Albert, no? So,
sige, anyway, mga bisinos, di Sara Servidor Albert Luna, el manjunto po siyempre kung saras mañana with Doc Mile Amsid. Mga bisinos, mientras tanto, prepararé también kita para con el diaton noticia para luego na Dateline Zamboanga. Gracias con ustedes, gracias Doc Miles contigo.
okay. So mga bisinos, binaanay kita ko na kel issue del diaton Oficina del Turismo, no? Sabi ustedes, el diaton City Tourism Officer na si Sarita Hernandez, taplan niya yale abri con estos mga tourism spots aquí na ciudad de Zamboanga. Sabi ustedes, bueno cosa taase, si Ma'am Sarita Sebastian, di aton City Tourism Officer, kay manada dal di aton mga amigo y amiga aki na pueblo, bien board agad na kasa. So taplan niya sila, no? The City Tourism Office, strict safety guidelines and health protocols must be in place before local tourist destinations in the city can reopen, the City Tourism Office said. In response to queries on the possible reopening of tourism spots in Zamboanga City following the modified general community quarantine. I-explica City Tourism Officer na si Ma'am Sarita Hernandez na rules and regulations for this development must first be studied and finalized. Tan-finalize daw sila guidelines as far as the reopening of both islands, El Santa Cruz Island y también El 11 Isla. So, mga bisinos, man expect ustedes na tiene ese anuncio de aton na opisina del turismo aquí na syudad regarding el mga tourist sites. Ojalá ustedes kami na ya para pwede tamin ustedes soporta el di aton tourism industry kay bien bobo chao yagat el di aton tourism industry, no? Inisisita kita ayuda kay manada gayot mga na turismo di aton ya perde ka trabaho. Ese gayot el bien grande epekto del COVID-19, no? Now, man-segue kita po kay hunto ka naton el Department of Trade and Industry Provincial Director si Ma'am Grace Aduca kay explikale kanaton el mga importante provisiones akel mga tiene mga negosyo kere abri ara na modified general community quarantine. Yapidi kami ayuda di Director Grace Aduca para pwede tamin clarifika el mga importante provision de supplemental guidelines on workplace prevention and COVID control del COVID-19. So, Director Grace, buenas tardes.
Buenas tardes, Doc Miles, and our listeners.
Okay. Ma'am Grace, kera kami pili kuntigo dito yung abiso i of course dali update ko ng mga negosyante pati mga empleyado tatrabaha under the modified general community quarantine.
Okay, Mike. Good afternoon once again. LDTI pati LDOLE yan issue supplemental guidelines on workplace prevention and control of COVID-19. I think this was issued last August 15, 2020. So, este mga guidelines, YSL-DOLE pati DTI para ayudahin mga private institutions to develop minimum health protocols and standards in light of the COVID-19 pandemic. So this shall apply to all workplaces, employers, and workers in the private sector, including those establishments inside the special economic zones and other areas under the jurisdiction of investment promotion agencies. So, included the aton Ecozone, then the Clark Development Corporation, then another free port authority.
Okay,
So,
Director Grace. So, man-start kita on increase physical and mental resilience.
Okay. Sabi ko, Mike, since this pandemic daw yakidaya anxious el mga di aton mga employees. So necesita el employers should provide psychosocial support. Meaning, if the employees are showing mental and health concerns, so they have to refer them to an accredited mental health specialist, such as the National Center for Mental Health Crisis, or liyaman na di ilang mga hotline numbers, and then they should refer these workers to the NCMH. And then the employer should also promote work-life balance, meaning not every day sila man anda na trabaho, they should schedule properly el mga scheduling del mga empleyado, like pwede sila on a rotation basis or a 4-day work week. So depende na sila mga employers. So they should maintain or increase the physical and mental resilience of their employees.
Okay, gracias Gayot. Now what about reducing transmission of COVID-19, Director Grace?
For reducing transmission of COVID-19, as usual, the face mask should be worn or must be worn at all times. And if the N95 or N88 masks are available, so these are encouraged for the private workers. And masks with vents should not be used. Akal ba daw siya ni Aguero, so hindi si Debe. And if they use cloth mask, so Debe siya ni filter, they can use tissue paper or yung wet wipes, they dry that one, pwede as a filter. And once usaya sila ang cloth mask, once lang gayod, una best lang, then they have to wash thoroughly SM nila mga cloth mask. And once dry, pwede yatamin sila usa.
Alright,
then,
so, continue lang, Director Grace.
Then the filters should also be changed daily or once kaya sila cough or mansudis sila, dispose gayod dayon and then cambia dayon. So very important na man remember gayod ang mga employees kosa asin na mask kay chenebes kami kita may el mga mask takina na chim or taagara lang sila takita sila. So it's very important and necessary also to wash hands before and after replacing the filters. The same with before and after, putting on the mask. And debe numaman touch el mask kanebes mukha ni amyan natin kaya sila kita so numas gayod. And the mask should be properly disposed kay sabi man to punay lang onde-onde so problema na tamin na mga basura.
Okay.
Can I continue my?
Si, please, Director Grace, paborya.
Okay. Now kasi one of the added protection na takina supplemental guidelines is the use of face shields. Sabi naman to el ara, san require el mga kentas san ride na PUJs, siya nagayot face shield. So the same manner na mga privado, empleyado, debet siya na tamin sila face shield that should cover the sides of the face and the chin. Akal visor type, hindi si pwede. And while Chinese face shield, debe el mask, salya tamen, no makita el mask. But depende na nature dila trabaho kay Chine, like mga call center agents, syempre can disturb el dila headset si Chinese face shield, so they are exempted from, or they can remove their face shields while doing their job. And then they should also comply with physical distancing at least 1 meter or 2 meters apart. Then, even if they are already wearing their face shields or face masks, kanebes, kumpiyansa lang el mga los dimas kay ay kunose yo el mga di mga co-workers, so okay lang man very close kay siya naman yung mask or shield. No. Debe man observe kayo always physical distancing of 1 meter to 2 meters. And then frequent hand washing is necessary. So when you enter your workplaces, debe siya nila alcohol, or if there's a place where they can wash hands, for the employees, the better. And then after, siguro after an hour, pwede kami ma-disinfect with alcohol or wash your hands with soap and water. This is encouraged para to reduce the transmission of the virus. And it's also important that in place of work or the offices should display signages or visual cues that would remind employees to practice proper hand washing and other hygiene behaviors. Kasi like, baka abla lang sila, ay, okay lang man, kaya nuway man positive for how many times can report, iyon na office, nuway man ko sa pasa. But it's very important to remind all our employees, especially the private sector, by displaying signages in their offices. And then shuttle services are encouraged. Debe, nagayod mga shuttle services and mga medium and large size private companies. I've seen here na Sambuanga Dock Mines na like the canning factories, they are providing shuttle services to their employees. And in the shuttle services, debe tamen man follow or strictly implement wearing of face shields and face masks at all times. Then observe physical distancing and frequent sanitation and disinfection. If it's possible, avoid talking with each other, meaning the employees who are in the shuttle services should avoid talking with each other and on the phone. Pag necessary, of course, they can call. Dapat generate signage na dila shuttle service of no talking and no eating and no taking phone calls. And then the workplace, ventilation is adequate, meaning the natural air should flow to the opening by opening the windows and doors, and if it's possible, turn off air conditioning units. But I know na siya naman mga fans and mga dila opisina, so fans can be used instead of the air conditioning unit. The same with shuttle services, there should also be adequate ventilation. Numaya sila man on el aircon, man open lang sila yung windows para entra el aire. At least opening the window is 3 inches while in transit, and then the same in the office, observance of physical distancing of at least 1 meter and wearing a face mask and face shield shall be followed. And after proper disinfection is encouraged before and after use of the shuttle services. And to ensure proper implementation of these guidelines, the Occupational Safety and Health Committee shall facilitate the conduct of general webinars, virtual lectures, and training on COVID-19 prevention and control. So this is to increase awareness of to the employees about the COVID-19. And if there are smokers in the office should designate a smoke area. So the same with the office and the shuttle buses, those who are smoking in the smoke area should observe physical distancing and other applicable health protocols. Then, to reduce contact, those who are at risk population like the senior citizens, pregnant women, and individuals with underlying health conditions, and those below 21 years old shall continue to observe work from home arrangements. So, debe siya sila mga work arrangements for these most at-risk population. So when they are needed to work, they are allowed to report, provided a certificate of fit to work is secured from the OSH personnel and must stay in the workplace only for a specified number of hours. And there should also be restriction of mass gathering. So only 10% of seating capacity for meeting rooms. Like if there is really a need na meeting sila, dapat 10% lang of the seating capacity. But this is for high or moderate risk areas or in confined spaces. But for low risk areas and in open areas, a maximum of 50% seating capacity is allowed. Then during meal hours, siyempre, Senebet, mga employees, they bring their baon. So during meal time, hindi sila manhunto na si Chene pantry or canteen. Man schedule el quien come, or if this is not possible, then the canteen Chene mga protocols tamen, like of course they should observe physical distancing, and then they should avoid talking with each other. And if the canteen yung sa tables nila can put up a barrier para hindi man face-to-face el mga empleados, the better. Masks should be immediately worn after eating in canteens and dining areas. Use of communal items such as but not limited to dipping sauces and condiments, utensils, dispensers and straw dispensers shall be prohibited. And serving of buffet meals and other similar setups shall be prohibited. So dapat dala na lang ng mga utensils yung mga empleyado. Then the very important thing is the all employers or all private institutions should assign a safety officer. This safety officer will see sila akel mamira el implementation de ese mga guidelines from DTI and DOLE, and I know that some employers have also their own guidelines. So sila man ensure na debe na implement sa mga guidelines. And they are trained by DOLE. I know DOLE conducted several trainings for safety officers of private institutions. And then when there is detection of infection, okay, every day at the entrance, all employees and all officials should fill up or accomplish the health declaration form approved by the DOH. So if sa mga questions, and if the temperature is more than 37.5 degrees Celsius, then that employer official shall be denied entry, and they are brought to the isolation area. So that's another important thing, Miles, that all private institutions should have an isolation area. So ito yung area na if the temperature of an employee is more than 37.5 degrees Celsius, alianay le, kabar si sila doctors or nurses in their offices, so man-check. Or if not, pwede tamen denied entry employee si more than 37.5 degrees Celsius el disuyo temperature. So this health declaration forms, every day man fill up or accomplish mga employees and officials. And then the HR will keep this record para in kaso buyag-buyag lang siya ng mga positive cases sa dila office, So it can be easily traced or tracked si Kenya, manhunto akel positive this time and this day. So the health declaration form, of course, this should be handled in accordance with the Data Privacy Act. So the data collected should only include data needed for the purpose of contract tracing. So I've seen the form, so yung mga names lang, contact numbers, and then address, yun lang yung nakalagay sa form. And then the processing of personal data shall be transparent and that the person involved shall be informed of the reasons for such collection. Reasonable and appropriate security measures and safeguards shall be implemented to protect the personal data collected, and the personal data shall be stored only for a limited period and shall be disposed of properly after 30 days. So after 30 days lang, validity del form, after which the forms can be disposed of properly.
Director Grace,
Yes.
sabi tu, manadagat sa pregunta ba data form ta PDL mga negosyante at ta PDL mga negosyante na mga customer di ila, no? So, pwede lang to klaripika kung ng mga negosyante ta uwi aura, porque bagat sila necesita man fill up kung ese forms.
The forms are very important, Doc Miles, kasi this is for contact tracing purposes.
Okay.
Like, di ba, like, si Chene positive na deal establishment ay a safe person galikel, no? Di amon customer number 5. Tumira sila during that day and what time, ay, iste mga customers ya-entra hunto kung akilian positive. So, pwede sila man contact kel mga hente na or na di aton city health na ito yung nakasama ng positive, so they can trace those persons, so pwede sila man quarantine or isolate para hindi man spread infection.
Okay. Gracias. At least bien claro yagat ese Director Grace, bien comprehensive yagat LD2 yung explanation na publiko aura. I am very sure and appreciate gat sila el pasensya to yadale para lang gayot man-inform kung el public, el cosa taas LDTI para protekta tamen kung el dila mga salud.
Yes, in fact, BTI is planning to meet with the establishments, I think next week, to really explain the supplemental guidelines. Para
Okay.
sabitan sila, yes.
Ana bueno, so that means anunsya kita na el mga negosyante ali man expect ustedes el DTI ay bisita con ustedes kasi kaya gani sila man kwento con ustedes cosa ya presenta si Director Grace aura lang na di atong programa el supplemental guidelines, no Director Grace?
Si Kabar siguro mais added information lang. Example, si Chene positive na dila offices, example, mga 2 floors sila, kabar na first floor lang positive, pwede sila man close first floor lang, hindi the whole building. Parang selective or, di ba, selective lockdown or granular lockdown.
Okay, good points So that means that si por ejemplo na un building tiene un infectado, hindi to necesita tranca todo con el building, el floor lang, no?
Si.
Tiene ganito tauwi, Director Grace, sometimes el kwarto lang on the el contact tracer unless of course usali ko ng CR ansina, no? Pero na di aton guidelines ano lang el floor lang gayot on the apektao.
Si. Kay talya lang man tamen unless si man ianda si una CR or ianda na other floors, pwede naman disinfect. Pero most of the time, talya lang man na first floor. So first floor lang tuman ko close.
Director Grace, este klase de guidelines, how long do you think this will be in place?
I think until the COVID-19 is still here. Sabi naman to, di ba, do sabi kita si Cuando ngayon no hay el COVID-19. So until this pandemic and then the infection is still here, na wala these guidelines will be in place.
Ansina, oo, no. Kabar, hopefully, Director Grace, maybe next week, lama kami kuntigo. Kasi sabi kami, akil mga asistensya para na mga negosyante, parang chene ata announcement, no? Como hinay-hinay ustedes tan announce, igual akil Small Business Corporation, el economic package, di ba? Chene ustedes kanila como asistensya tadale?
Sí. El first tranche, kabaya, kaya yung mga yan avail this time. Sige, I will talk that in details next week perhaps. Second batch siya Dr. Mile.
Na bueno, oo. Pero niya gayot, Director Grace, na i-receive asistensya ng gobyerno through the DTI or through the Small Business Corporation, aki na Zamboanga City.
As of, man-announce lang yun, as of, I think, end of July, 42 MSMEs already availed of the first batch of loans with total amount released of, I think, 2.4 million.
Okay, 2.4 million i-receive 42 jutay negosyo or negosyante receive asistensya totaling 2.4 million pesos. I-receive as of today, no? Director Grace?
Yes, Martha.
Okay, so very comprehensive presentation di Director Grace kanaton mga bisinos. Ipidigan niyo kuntigo Director Grace LD2U mensahe na publiko aura para tamen hindi sila ulbida ako sa LD2U summation cosa tu i-presenta kanila. Ohala imbita tamen tu kanila kay syempre imbita kami kuntigo next week para explika akil mga economic relief assistance ay dale LDTI na mga MSME.
Okay, thank you, Miles. What I would like to say, especially to this establishment, naman follow lang kita ko sa mga guidelines na national as well as the local governments and other government agencies because we are doing this one not for ourselves or the government but for everybody. We are protecting the lives of many Filipinos, and I think these guidelines are really helpful not for all of us. And since you have been complying with the previous guidelines, so there are some new added guidelines here, and I know that you can do it. Hindi naman ito masyadong mabigat sa inyo. I think this will really help you and your employees. So we will have to comply. On our part, we will help you also in disseminating all these guidelines, not only to the employees, but not employers, but as well as to the employees. Kasi minsan, Miles, we have very good guidelines, but in terms of implementation and compliance, mahina gayud kita. So, alya kamitan, that's why we are monitoring with DOLE on the compliance of all these guidelines.
Okay. Muchas gracias, DTI Provincial Director Grace Aduca. Okay, mga bisinos, manada ka to ustedes Jose pwede uwi aura, no? Yan start kita. El di aton da programa el Be Hertz, no, under kun Engineer Al Urao kay Tamandamira el local government aura taas esfuerzo para kontrola kun el COVID-19 epidemia. Sabi ustedes base na di aton datos tasubi el infeksyon aki na Zamboanga kay hindi man tamay kay paltal esfuerzo kay el mga gente aura bien libyaw ya para kami na onde-onde kay under modified general community quarantine niya kita mga bisinos. So naturalmente el mga gente aura ta pwede ya kami na, ta pwede ya anda na mga restaurant, ta pwede ya anda na gym, pwede ya gani sila anda na misa, of course pwede sila anda na dila mga barberia, otro pa mga lugar pwede sila anda, no? So definitely man expect kita el level de infection ay subi. El gobyerno lokal under Mayor Beng Climaco taasya gani sila esfuerzo para prepara el sitwasyon, especially alina barangay. So ese gani programa del barangay health emergency, no? Talama sila sa BHERT, pati el mga contact tracing. Man expect ustedes mga barangay leaders na andaya con ustedes el LGU para koordina, para creaya el di ustedes mga contact tracing teams, pati el di ustedes barangay health at talama sila BHERTs, no? At the same time, si Director Grace Aduca tamen niya explica con el mga negosyante pati akal mga tiene mga establishmiento aquí na Zamboanga el mga additional guidelines na necessary gayot ustedes para nisisita nota kay amugane tabla si Director Grace nisisita ustedes protekta el di ustedes empleyado, protekta el di ustedes mga kliyente para el di ustedes negosyo ta continua lang siyempre maskin tiene kita epidemia aura, no? So quiero lang yo dale el di mio punto por punto ara de noche. Quiero yo con ustedes habla na aquel anuncio di Ma'am Sebastian, no? Sarita Sebastian, na abri el di aton mga tourism spots. Kumigo bien bonito se announcement el yadale el di aton city tourism officer. El first point di mio, difícil kita ahora sale anda otro lugar, otro ciudad y otro país. Necesita kita descubrir el cosa bonito aquí na Zamboanga. Sabi ustedes, ta tiene miedo sale na Dios ustedes mga lugar kay no quiere ustedes sa ka-infeksyon. Pero el bonito tamen quiere el second punto di mio, manada mga tourist spots di aton aura. Ese mga lugar open air sos at the same time el level of infection alin na mga barangay diyan baho gayot. So you take advantage to relax, to exercise and to see the beautiful tourist spots aquí na Zamboanga City. Manada kita onde puede anda. So eso di mio punto por punto ara de noche. Quiero no ustedes olvida ko sa habla si Doc Mile. Pensa ko na solusyon, hindi ko na problema. Ino makita perde esperanza. So hasta mañana, manhunto-hunto ya también kita.